Hi, this is Dr. Dennis Nikitow. I want to thank you for joining us on our Chiropractic Approach to series. One of the things I want to start off with here is I want to talk a little bit about a three-dimensional system. Now, there's two types of chiropractors, okay? And in our clinic, we use a three-dimensional correction system. The one type of chiropractor just works on musculoskeletal back pain. However, chiropractic is not a back pain treatment. We're basically nerve doctors, so what we're looking for is we're looking to see if the spine is out of alignment and affecting the nervous system, compressing on the nerves. Okay, the reason we check the spine is to see if the nerves are being involved or compressed when the spine or posture is out of alignment. But what I want to address today on this particular program is our three-dimensional correction system. So if you want to correct your spine, first of all, you need to find a chiropractor who does spinal correction, okay? And we use a three-dimensional coordinate system like they use to track satellites. It's called the Cartesian coordinate system. Now, what's real important to understand is because the Cartesian coordinate system is how we track satellites. So basically, we have an x-axis, we have a y-axis that goes this way, we have a z-axis that goes this way. So x, we have a y, and we have a z-axis. Okay, now anywhere along those planes, the spine or the posture will move. Okay, so basically this would be a postural distortion where my head is actually moving on the x-axis. Okay, and it's translating. Okay, when we have a rotation, we would look at a patient and see if they're rotating this way on the x-axis, or their pelvis could be rotating back and forth like this on the x-axis. Okay. On this y-axis that goes up and down, the patient can rotate around it. So imagine a rod going up and down, and imagine the patient rotating or their shoulder rotating back and forth. Now, the reason this is very important to understand is because if this isn't addressed when a chiropractor is working with a patient, and they're just doing what's called regular diversified manipulation, where they're just laying you on your back and just decompressing joints, these types of distortions will never go away. They'll continue to be there because what we're dealing with is changing what's called nerve-muscle memory. If, say, you're driving a car and your arm is up on one side and you're leaning on the armrest, what's going to happen over time is your shoulder's going to be high, your head's going to shift into that shoulder, and you're going to start to compress on the disc joints and nerves. Okay, similar to if you're working with a computer and you're sitting and you're doing your work here all the time, as you're turning your torso on your hip, you're going to end up with your pelvis twisting this way, your torso twisting this way, and you're going to have a lot of low back pain wrenching across here because the pelvis is actually rotated. Well, this isn't addressed all the time with all chiropractors, so it's really important that you as a public understand this three-dimensional system, okay? Because the pelvis can twist or rotate, okay, and when it does that, it's going to cause a ton of compression on the discs, joints, and nerves. In fact, that'll wear out the discs 10 times faster. If you have a translation this way or this way, what will happen is that you're likely to, since you're carrying the weight more on one hip than the other, you're likely to blow this hip joint out or that knee over time. This is why people get hip replacements on only one side, okay? So you need to make sure you're dealing with a chiropractor that looks at all these dimensions, not just laying you on your side and popping your back, and then you're wondering why does it keep coming back. It keeps coming back because these types of dimensions are oftentimes missed. Now, when we look at a patient, again, from the neck area, the head could translate, it could rotate, it could tilt. If we turn from the side, a very common postural distortion we see is what's called a forward head posture. When a person has a forward head posture, and this is very common from whiplashes, because when you get a whiplash, for some reason, neurologically, the nerves turn on here and pull the muscles forward, and they turn off here, so the head is left in this position. Well, if it's left like that in that position over a period of time, what happens is the discs are getting compressed. As the discs get compressed, okay, what ends up happening is the spinal cord goes into tension. Now, if you were to look at your hand, okay, in a relaxed position, that's the way the neck should curve with the skull sitting on top. Well, the spinal cord should have wrinkles in it. So that gives a nice relaxed position. The spinal cord, good nerve transmission. If the head is left in a forward position, it's just like putting tension in your palm, it tensions the spinal cord. This is why when people have forward head posture, they get a ton of headaches. This can affect the hormones, it can affect mood, it can affect all the hormones that are going in and out. It can affect the immune system. This is the center for the hormones, the immune system. This is why people can get sinus problems, headaches, allergies, because the skull now is being pressed down on these specific nerves as they're coming out of the brainstem, okay? It can affect your vision, it can affect your hearing, it can cause dizziness, it can cause anything from A to Z, because that brainstem area is a control center for the majority of our posture in our body. It controls organs, it controls lot of functions, okay? So the other thing that can happen is you can get a lot of tension here because as your head is forward, the muscles are pulling like crazy to try and hold the head up. Imagine taking a bowling ball and holding it here and then holding it way out here. This area up here has to work so hard to hold it, eventually you can't. Well, that's why at the end of the day, if you have forward head posture, you're burning in here, you're aching, your shoulders are aching, and that can start causing that big bump to start in the neck where that sticks out here. Now, cosmetically, people don't like that, but more importantly, it affects the disc joints and nerves here. Thirdly, what will happen when you have a forward head, your body senses that it's falling, so it pushes its hip forward to match where the head is at, and now you start to hold all this weight over here on the bitty joints of the back, so they get compressed. There's no disc in there to hold, like to cushion it, just like between the vertebrae. The vertebrae are designed where they have a blocky part of the vertebrae with a disc in between. That's supposed to carry the weight. So if this angle is off here in your lower back, it's going to feel like you always got to bend over to stretch and to stretch your low back. Okay, so it's very important, like I say, that all these components are addressed in a three-dimensional system. Now, when we fix a spine and posture that's off kilter and bring it back to center, we take an x-ray and then we take x-rays later to show the patient that they've actually been fixed. If you're going to a chiropractor that hasn't taken x-rays, then you're not usually going to a corrective care chiropractor. And chiropractic was designed initially, over 100 years ago, was developed to fix spines, not to just treat a bunch of symptoms. So basically, not only will we be able to fix your symptom if we do this, but we're fixing the actual cause so it's stable. And once we fix the spine, it's fixed. Now you maintain the correction versus just managing the symptom, where you got to keep coming back for the same old symptom, things like that, okay? So once again, we're looking at all these different dimensions. I mean, this can have a profound effect on the knees, on the hips. If you're twisted, it can affect your hip joint, it can affect your knee. If you've got forward head posture, it can affect your TMJ or your jaw because it gets tighter, it starts to click and pop. So you need to get to a corrective care chiropractor that'll help you with those. Now I've got Luke over here, and I just want Luke, go ahead and look into the camera. If we're going to check a person, the first thing I want you to do is close your eyes. I want you to kind of shake around, shake loose, shake your shoulders, step in place a few times, and then stop. Keep your eyes closed and look straight as to what you think is straight. Now, one of the things we're noticing with Luke is that if we look at the center portion of his posture, which is right here at that little notch, his chin is over this direction. Okay, now if we look down here where his belly button is, we'll also notice that his belly button is over in that direction. That's not uncommon because the hip wants to sit underneath where the skull is. So this is called translation. His head is going this way, his hips are going this way. So Luke's going to have a lot of problem with pressure, keep your eyes closed, pressure at the base of the skull, pressure over here. Now the reason we have the patient close their eyes is because what we're doing is checking a system called proprioception. It's the balancing mechanism with gravity of the nervous system. You see, your body has tons of nerve receptors, and they're telling your brain wherever you're at. So if you're bending over one way, you don't fall over because those receptors are stimulating messages to the brain to tell your brain that, hey, I'm over here. Now, there's fast receptors and slower receptors. The chiropractor with the adjustment does not move a bone into place, but triggers the nerve receptor to fire to the muscle. Okay, so basically we're triggering that mechanism. In an exercise of correction, the patient works on the slower nerve receptor. So basically, in Luke's case, if his head's over this way, we would adjust his neck in this direction, and he would do exercises over and over and over again in this direction to stimulate the slower portion of the nerve, and we'd stimulate the faster portion nerve. This would give us great success because now both areas are being stimulated to bring that head back into position, so this will be stable. Okay. The reason we have the vision removed is because when a patient, say, opens their eyes, their whole posture changes. With the eyes closed, we can tell which way the nerves are actually overfiring to one side or the other. So now we know that Luke's has a translation here. He's got a head translating in this direction. You can open your eyes now. Now I want you to turn to the side and just look straight ahead. If we see Luke from the side, we'll see the center portion of where his shoulder is should line up with his ear. Now we can definitely see that he's got forward head posture. With a forward head posture, it's going to put a lot of compression here, and we know that Luke's got problems with headaches. He was in an accident, he's got dizziness, different things like that that were causing that. Now, if you face again the camera, I'm going to touch the front of his hips. Now, if you were to turn just to the side a little bit, okay, now as I touch the front of his hip here and here, we could see that when my hands touch his hips, they're not level like this. His right one on this side is actually more forward than the left one. So he actually has a twist going on here. So now what we're going to do is make an adjustment to make some of those corrections. Go ahead and lay face down for me. when we make the adjustment, or your chiropractor is going to make an adjustment for this, we go into the mirror image. If the head's this way, we're going to have the patient move in the other direction to make the adjustment. So Luke, I want you to move your chest and shoulders to the right. Okay, move your chest and shoulders there, because that's where his head was. Now his head is to the left. So I'm going to make an adjustment here, and then we're going to come over here and adjust this portion this way, like this. Okay, now go back to the center. Okay, now we also know that his hips are too far this way. So now move your hips to the left, way over to the left. So we're making them cockeyed. Now we're going to trigger the nerve impulses here that govern the posture here by just adjusting numerous times. We're firing the nerve receptor. Remember, we're triggering the nerve to tell the body to pull the muscles differently. Now he's laying up pretty good in this direction. Now in terms of his rotation, I'm going to have you now lay up on your side, and you're going to face this direction. And now what I'm going to do is I'm going to have you keep your legs kind of straight and roll your tummy towards the table. Now, in this particular adjustment, you'll notice that his legs are straight. If you've gone to a chiropractor and they're actually bending the knees, what they're doing is working on a torque of the hip. This is working on a full rotation of the hip to take this actual position here out. Instead of torquing this way, okay, and taking that portion out, his distortion is on rotation. Now, if you're going to a chiropractor and you got low back pain, and you got pain that's going on right up in here, in between the shoulder blades, or kind of just on the low end of the shoulder blade, it's usually this rotation. Because by the time you rotate, and if you were to do this test and stand up and rotate, as you rotate and hold your hip forward, you'll actually feel it right there. So it's like where a woman would have right at the bottom of her bra strap, or the bottom of your shoulder blade right here. So basically, what we're going to do is now unwind that pelvis by triggering the nerve to tell the muscle to move in that direction. So I'm actually going to be adjusting this way, and I'm going to be pushing his shoulder in the opposite direction. So we'll come in here like this and adjust straight down. Okay, now lay on your back. Now when you see this, chiropractors, and you see a rotation, you always want to check the hip joint, because that hip could be running a lot more forward in the pelvis. So what we're going to do here is check Luke's hip, and we do see that. What we're seeing is that this hip is actually more forward or up compared to this one as we do it. So we're going to take the head of the humerus, or where the hip is, and we're going to actually make an adjustment there. Okay. Now there's a couple ways to do this. Okay. What we'll do first of all is we'll check here on his rotation on his pelvis. Now he's got no external or internal rotation. Okay. When we move his foot out, hardly moves. On this side, when we move his foot, it moves a lot. Okay. So what we want to do here is this. Okay. Number one, I'm going to just adjust his hip joint. Now, not the pelvis, the hip joint. Straight down using a drop. Now, let's see if that's changed anything. Okay, he's got a lot more rotation already. Now, the other way you do this is you can take this, okay, and move it outward as far as you can. Okay, and then you're going to take this and thrust it straight down. So one of the things I'll do is I'll take this like this. I'll turn the hip out as far as it can go and adjust straight down. Now, if we look at the hip after moving it just a little bit, look at the movement we have in it. Okay, now, come on up, Luke. Just take a lap around the table. After you adjust a patient, you always want to have them walk, because the walking stimulates that proprioceptive or balancing mechanism again. Now we're going to take a look at him again. Go ahead and look right at the camera. Okay, now go ahead and close your eyes, shake around a little bit, look straight ahead. Now if we look at Luke, we take a look at where his center portion is here. It's lining up directly with his chin. Okay? Secondly, if we look down here where his belly button is, lining up perfectly with his chin, or with the center portion of posture. If I check, turn facing me. If I check his pelvis, he's perfect. So now he's exactly like this. Okay? Now, the last thing we're going to do is we're going to work a little bit on his forward head. Have a seat. Lift this up, lay back, and put your head back. Now, a lot of times, like in Luke's particular case, he's jamming the collarbones in here. So what we're going to do is lift his arms up in this stick him up position. We're going to adjust his collarbone right here. So we have him back. Okay, good. And then we're going to adjust his head this way to trigger the nerve impulses in the forward head. We're going to usually do about 3 or 4 of these. Okay? Put your arms down this way. Okay, now sit up. Okay, now take another lap around the table. Now come right over here, and it's facing me. Okay, now just shake loose, close your eyes, and then look straight ahead. Now, as we see, what's happening is okay, his head is actually starting to move back a little bit, okay, because as we saw before, his ear was way far forward from the shoulder. Now, as you trigger these nerve impulses with the forward head, it pulls, it's actually activated this section to pull the head back. So once again, now we'd have to do this repetitively over and over and over again because we have to override what's called nerve muscle memory, where the head is used to doing this, and now we're going to be doing it this way. So the patient will be given certain exercises like pulling their head back like this that we have in what's called our chirometric series of exercises. These are specific exercises that we have for patients for spinal correction, okay? Because you have to use what's called isometric exercises for spinal correction. You can't go to the gym and work out with weights and think that your posture is going to be better, because that's what's called phasic muscles. They pull opposite of postural muscles, okay? So hopefully this little series, the chiropractic approach to, has helped you and is helping you kind of gain some more insight in terms of how we actually fix spines as chiropractors. But once again, there's two types of chiropractors. One's kind of more or less going over the musculoskeletal symptoms and treating that, and we're actually doing spinal correction. One of the ways you know the difference is they will explain to you the different dimensions and give you certain exercise like the chirometrics exercises that we give our patients that will actually be mirror imaging, so you overload that side of the circuit. If you're only going to the chiropractor, kind of giving you basic regular physical therapy exercise, stretching your low back, then you're not actually fixing your spine. And most importantly, you definitely need to see some before and after x-rays that will show you that your spine's been fixed. I hope this gave you a lot of insight and a lot of help. Thanks again, and I'll see you later.